Welcome, everyone, to the athenahealth and ChronicCareIQ Customer Expert Panel. I'm your host and moderator today, Justin Barnes. It's great to have our audience, and thanks again to everyone for taking time out of their busy schedules to join us in our latest in our series in sharing chronic care management strategies as well as best practices. Today, we're joined by Lori Francis, Clinical Director of Louisiana Cardiovascular and Thoracic Institute in Alexandria, Louisiana. Welcome, Lori.
Hi, thank you for having me.
It's great to have you. And Jerri Medved, co-owner of HomeMD Housecall Services out of Waterford, Michigan. Welcome, Jerri.
Thank you for having me also.
We're all very excited to have this panel today because you both bring very unique experiences. For example, Lori, you've been leveraging the Athena platform as well as the ChronicCareIQ platform for many years, and I think Chronic Care for almost 9 years, which is extremely exciting. And Jerri, you're newer to the Athena platform, just under a year, but then also using Chronic Care just for a few months, ChronicCareIQ just for a few months. And so very unique perspectives. It's just great to have you both here sharing your key strategies, your best practices. So before we dive into some of the questions, Lori, please share a few words about your practice in your community that you serve.
Sure. We're a cardiovascular and thoracic institute, really in the center part of Louisiana. We're in a very rural area of the state. We take care of everything cardiac, thoracic, lung, and now metabolic and diabetic as well.
Excellent. And Jerri, your community?
Yes, we are a house call program that we service the seniors that are homebound. We currently service the entire state of Michigan, so just over 5,000 seniors' lives that we take care of in a variety of settings, from assisted livings to memory care.
Excellent. And certainly a very special guest, as everybody sees here as well. Chronic care management expert, Matt Ethington. He's also co-founder and CEO of ChronicCareIQ. Welcome to the show, my good friend.
Thank you. Thank you. And I appreciate Lori and Jerri joining us, because literally we have one of our first, I think we were one of our first 100 customers on board with LACVT, and just watching the way that Lori, the care with which she builds her program and the patient focus that those patients get has always been a standout to me. And then when I met Jerri after she had signed up with ChronicCareIQ, I just scheduled a 30-minute call because I wanted to learn more about their program, and we spoke for 2.5 hours. And so the commitment to patient care here is extraordinary, and I'm so glad that we're able to speak with them and set an example for folks about how to succeed with care management.
Absolutely. And the people on my network and from my show know Matt very well. He's a frequent guest, a very good friend of mine, been an industry colleague for almost 20 years now. And again, a frequent guest on the This Just In radio show. So always great to have you here, and certainly look forward to you adding in. And if there's any components that we may have missed during this conversation, Matt, please feel free to share. This is gonna be a conversation. We have thousands of users out there across the country, and Athena is one of the best EHRs in the industry, and so we're very excited about this opportunity. We want to educate, really encourage and empower people to want to dive into care management or expand their programs. I mean, there's a ton of opportunity. Matt and I have personally done many radio shows in the past 6 months on this topic specifically, as chronic care management is a natural glide path into value-based care and into where the future of healthcare is going. And so with that as a foundation, we really want to start bringing more of these expert panels to you with these great customers out there that are, going through programs. They've gone through ups and downs. They've gone through everything that anybody else is going to go through, and emerge on the other side tremendously successful. So we look forward to, diving in and having these types of conversations more and more. So I'll start off maybe with you, Lori. And again, this is for both panelists, and Matt, again, if you have any color you want to add at the end, feel free to as well. But Lori, what made you decide to participate in chronic care management program in the first place?
Well, I came on board prior to COVID, and I will say this was a lifesaver once COVID hit, but we had already been doing it prior to that. And like I said, we are in rural Louisiana. Most of our patients are an hour to hour and a half away from the hospital where we're located. Many times it's really hard for them to get in to see us, and we were looking for something to help bridge that gap. Dr. Jones is our cardiovascular thoracic surgeon here, and he has a motto he's had for years, and it's high tech, high touch.
Yeah.
So, we love all the technology coming out, but he wants us to be able to, keep hands on the patient, stay connected to our patients. And this really helped bridge that gap.
It's excellent. Jerri, what made you start the program?
Yeah, well, I started out as a hospital case manager, and I was very frustrated with, pretty much the frequent flyers. They just kept coming back, and the case managers would get in trouble for that. So, I really started to recognize these seniors don't have a resource system out there. So MIPS had hit. All my favorite doctors were going to quit. They were just didn't know how to handle it. So I actually left the hospital system and started a company helping them with MIPS. And it evolved into putting nurses in their offices and doing chronic care management. Fast forward, met a house call owner. We ended up merging during COVID because of the lines became too blurred. And that is where it's really taken off. And I'm a little bit of a CCM snob on these platforms. I've been through many of them, and Matt and his team were great with me. And boy, have I been very surprised with how effective and efficient. It's just a beautiful program, as well as Athena. Athena is just an amazing program itself. So two of these changes that we've made this year have made a huge impact, both, with our satisfaction with our patients, our staff absolutely love the programs. And so it's been a great ride, and with CCM and being able to connect, that's the piece that's really missing a lot of times. Our doctors don't go out into people's homes. And if you're like my grandma, she gets ready for, a week to go to a doctor appointment because she wants them to tell them how young she looks. But the doctor doesn't know. She barely gets out of bed and she's depressed and she doesn't eat. And, those are the things that house call providers can do. And Matt's system he's already saved, 2 readmissions to the hospital for us.
Yeah, no, I'm looking forward to diving into that for sure. And we know Matt and I talk a lot offline because we're really trying to encourage, and you both give some great use cases of why you started chronic care management in general. But I still think you crunch the numbers, we still have less than 8 or 9% of the country that are truly adopting chronic care management programs. So we have a long way to go of eligible providers and providing these types of services. Because us as patients, and again, Matt and I talk about this all the time, we deserve it as patients. So, and never mind what it does. It's great for the healthcare system. It's great for our economy because it saves so much money and it saves lives. But it also, as from a provider and a patient standpoint, they all deserve it. We all deserve it. So it's great. And again, glad we're here today. And again, you both have different use cases. So when you begin looking for a platform to support your program specifically, what was most important to you? So Jerri, why don't you start off there?
That's a great question because there's a lot of programs out there that, they're basically focused on things that are not going to make a change in that person's life, in that patient. And, they're not medically driven. And I really don't need somebody calling the patients and talking about the cat and the weather and all the things that are not going to really affect their health and their a way to, maneuver through the fragmented healthcare system. And so that was what the largest thing that, I focus on when I'm looking at CCM programs is if they're medically driven. And, CCIQ definitely hits the mark with that.
Thank you. Excellent. And Lori?
For us, we started so long ago that we were really just looking for something that was user-friendly for the staff and user-friendly for the patient, but was also accurate, would help us in collecting the data. And we were just kind of starting from ground zero. We really didn't know anything about home monitoring at that time. And we started with CCIQ, and it's just been fantastic.
Fantastic. And you've even switched EHR. So that was so you actually stuck with ChronicCareIQ. You've been with it, I think, almost 8 or 9 years now. But then I think 4 years ago, you said you went over to Athena. So how was that? And obviously,
yeah. So it was kind of a funny little story. We started with CCIQ, and we were using a very antiquated EHR at the time. And it worked. Everything just worked fine. And then somewhere along the way, we left CCIQ, but only because our CEO went to a convention, saw some technology that promised a lot of things, and we switched and we hated it. And we all threatened him that we were going to just quit if he didn't go back to CCIQ. So we went back to CCIQ. Everybody was happy, patients and staff. And then we transitioned into Athena. And, you know, change is always difficult. And we were always like, we can't take another change. And it just meshed beautifully. So it was a very smooth transition between the two.
Yeah. No, it's excellent. And to hear that, obviously Athena has one of the best integrations in the industry, or their APIs are fantastic. So it makes it much easier to work with. And also, but the user experience at the end of the day, you know, means everything and to you guys. So
and it's so helpful in helping identify patients, you know, who may not be enrolled but need to be. And Athena's really good at helping us identify those patients.
It's excellent. Excellent. Anything you want to add on to there, Matt? I know they're talking about your company,
Yeah, Justin,
baby.
so they mentioned that tight integration. So now, by the way, between the two of you, I know that you've each tried, Jerri, before we met you, you tried 2 different systems. Please don't mention them. And then, Lori, I know where you came from initially, but I don't think I knew that your team left. So I'm like,
it was early on, and it was free. And actually, we really didn't leave. We kind of were trying out something else simultaneously, and we saw the difference real quick. And
yeah.
Well, I'll give you, so just to give you real quick some color on Athena, we have a practice that was purchased by a hospital, had to switch to Epic, and they don't have the interface quite there yet, but the time, the reductions in time, because we plug into the EHR so that we can see the other non-face-to-face work that's done for the patient, things like refills and labs and orders, and the amount of work that's done. And it was 40, it was a one doctor practice, it was 40 hours worth of non-face-to-face time in activities that were in the EHR for that one doctor practice that month. So it tells you how important it is to sweep up the time, that the work that you're performing in the EHR, because it counts too.
for sure.
Absolutely.
Yes. And you know, it also focus, you know, when our nurse practitioners are out there, a lot of them, they'll get upset about not being reimbursed for, you know, the families that call every other day and different things like that, you know, with our payment model. And the amount of less, I guess, I'm not hearing the complaints that they have to call, they have to coordinate, you know, so many days throughout the month. It's made their job satisfaction, you know, they feel valued for all the work that they do, the hard work they do. And it's not captured, it's just left on the table, and it's just expected, where, you know, I believe CMS and Medicare understands that and really wants, you know, providers to be reimbursed for the service, you know, for all the work they're doing, because that's going to cause them to have a decrease in spending, because we're going to keep them healthier, happier out of the hospitals.
Right. Absolutely. Yeah. So, and Lori, I'll start off with you in this one. What ultimately stood out about ChronicCareIQ and made it the right choice for your team? And certainly, as you know, you left the platform for a little while, or was looking at another product, and the other shiny object that was out there that didn't quite work. But what were some of the items that you liked about the platform that worked for you in your practice?
There's many things I like about it, but the user friendliness is the main thing for both the staff as well as the patient. It's easy for them to log in. It's easy for us to set up. That, you know, that was like the first thing that really jumped out. I do love the feedback we get, the monthly calls we do with CCIQ that answers all of our questions and helps us with billing and integration and just anything we're having, you know, problems with. That is bar none. I mean, just excellent service. And just the medical, like the care plans, everything is just very medically oriented versus just a bunch of fluff, and it's just real efficient, time efficient. It's the main thing.
Yeah. And Jerri, what are some of the items that stood out for you that you noted is the right choice for your team? I know you've only been on the platform for a couple of months, but what are a few things that stood out to you, or have stood out to you?
And actually, this is my 5th platform, not my 2nd. This is my 5th platform, and we even tried to build our own because I was so frustrated, and boy, a lot of money wasted. If I would only found Matt when Lori did. The phone tracking system is very unique. I have not witnessed that in any other program out there. And really that has been amazing. The integration, the rollout was probably the most seamless thing that platform that we've ever rolled out. Matt's team is amazing. They're always available and helpful. And probably, the whole bi-directional. We've never been able to experience that with any other platform. The way that it just completely integrates and flows back and forth seamless, it's almost like it's built like Athena built it. It doesn't feel like it's a separate program.
I will say that when we were with our other EHR, we would go back and manually enter everything into CCIQ, if we had called in prescriptions or whatever. And the first time we realized that when we were with Athena, all the work we were doing and the scripts we were calling in was plugging into CCIQ. We were like, wait, it's there automatically. And that was like huge time saver.
It's a game changer for sure. Excellent. So now diving into some of the on the clinical aspects, patient stories and metrics that you maybe pulled out of the system or been able to realize over a period of time. Are there any specific stories, or again, financial metrics or even clinical metrics that show the shift that you've seen since using ChronicCareIQ? I'll start off with you, Lori. Yeah. For
sure. I mean, through the years, there have been many. I will say for us, we monitor mostly blood pressure. And, as a physician and a provider, most patients come in and they have, white coat syndrome and their blood pressure is not real accurate. And managing blood pressure medications is something that's very individualized. So if you just get one snapshot every 6 months, it's hard to know, are you really regulating the blood pressure? Where now, we have trends, we have patterns, we see what they look like in their home, we see what their blood pressure is without their medicine, with their medicine, and we're able to better make med adjustments with that. But in addition to that, we print up and we send these results to their cardiologist, to their oncologist, and so they have a good picture as well. As far as difference that we've made, we have kept so many patients out of the ER. I can recount many times we have intervened before a stroke happened. I remember a case of an elderly man whose wife had passed away suddenly, and she was responsible for all of his medications, and he really didn't have extended family. And so he was taking too much, and he didn't realize it. And we picked up on all of a sudden his blood pressure is really low. We intervened, we fixed it for him. That would have been a trip to the ER, if not worse. Recently, we had a patient who I picked up on some major changes in his heart rate and his vitals, and we got him into the cardiologist. And on Friday, last Friday, Dr. Jones did a 6-vessel bypass on him. So, and he had a significant family history of sudden cardiac death, a young guy. So there's just been many, many cases that I feel like by using this platform, we have been able to prevent emergency room visits, stroke, heart attacks, just take a more preventive approach for the patient.
Fantastic. Thank you very much, Lori. Jerri, what are some of the things that you've seen?
Yes, I can imagine the stories since she's been with them for so long, because we've seen, I've tracked it, 8% reduction in hospital admissions.
Wow.
And then, like I said, it's been a very short time. The thing that was really kind of exciting for us, because we just kind of jumped in with both feet and didn't look back. And one of our strongest medical assistants, she came to us and she's like, I don't know what to do. There's these questions that one of the patients answered, that they're not feeling well, they can't breathe right. We only see them quarterly, and reached out, and we got out there right away and prevented that hospitalization. We wouldn't have known. They, like Lori said, they would have just ended up, that's the only phone number that everybody knows, that 911, and they end up in the hospital system, and they decline faster because, they don't want them to fall, so they leave them in bed. But, the thing with those questions that go out, the patient satisfaction, and they're honest in their answers, and it makes it where my team knows who to reach out to, because a lot of times they're not the squeaky wheels calling our office every day. They're the ones that will sit there and silently suffer until they're too sick to, kind of get them to bounce back. And that's why in between these visits, we need something that can capture those declines so that we can keep them, healthy, happy, and in their home as long as we can.
Yeah, and I love the fact that you both focused on obviously the patient care and the care quality and the care improvement because obviously there's a significant piece financially rewarding behind all this care management as well. And I think the average Athena practice that uses Chronic Care IQ integrated into Athena is roughly $13,100 per provider per month of additional revenue, basically getting compensated for the work they're already doing in most cases, in many cases. So and the fact that you guys didn't say that, you didn't talk about the money aspect, is always about patient care and the care quality and care strategy, but it's very, very exciting. So, thank you for that. So diving in also in that direction, what does excellent chronic care between visits look like in your practice? I'll start off with you, Jerri. And how do you use, CCIQ or Chronic Care IQ to enable that?
Well, when we met CCIQ, we just started to tear apart our original CCM program. It was just not meeting the mark. So, I'm pivoting it a little bit. It's going to be a more disease specific model where we have specialists in each chronic illness that most of our seniors suffer from, the CHF, COPD, diabetes. And from there, Matt and I've had a lot of discussions about how we can, kind of isolate that, and we can be able to help with exacerbations of these certain conditions. And with the monitoring, with the remote monitoring and the questions being sent out, and his ability to work with us to shape that for us, because we are a little more unique. We service, our average age is 85 and up, and we service the sickest of the sick because they're homebound. So, CCIQ has been remarkable in, helping us to achieve that goal where we can dial in a little more on, disease specifics and help to make a difference, educate. And, that's my big background, education. If we can educate and create a plan for most of these patients, we are going to have better outcomes. And yes, you heard, we didn't really talk a lot about money because I'm sure Lori is driven, and Matt, that's why I was on the phone with him that long, because there's very few healthcare professionals out there that I meet that have that same vision. It's about making a change. It's, the money will come when you make that change. You'll be able to keep your doors open. It's just, if we don't all step up and do something, our healthcare system is just going to keep deteriorating, and I don't want to see that happen.
Yeah, your community's your community is very fortunate to have you, Jerri. So fantastic. Lori, what are some of the
Justin,
go
guys,
ahead.
jump
Go ahead,
in.
Matt.
I think it's so important the way that Medicare designed these codes, and we don't, we used to not think of Medicare as innovative, but the vast majority of the codes, the monthly recurring codes, are based on the non-face-to-face amount of care that these patients get. And the first reimbursement starts at 20 minutes over a month. So it's the work that these patients required between visits.
Mhm.
And so Medicare's incentivizing practices to stay attached to them. And I think it's a $64 reimbursement. It's the first 20-minute increment. So that's, if you could monetize 20-minute increments perfectly, that's $192 an hour. So it's not really a surprise to people that do it well that the programs pay for themselves. But it makes me humble and proud at the same time to hear them talk about how they're getting that additional information from patients, and they're moving the needle on patient care by hearing back, what's going on with those patients. I was a patient, which is what inspired the platform, and I was worried and sick at home, and I didn't want to bother anybody. And this just it echoes the experiences that all the practices are experiencing. So
Yep. No.
I'm so happy to listen to y'all. Thank you.
Yeah, absolutely. So, no, and hopefully the programs pay for themselves in spade. I mean, there's significant ROI, so it's very important, the financial aspect as well to follow suit, which it always does. So, Lori, now to you. So, what does excellent chronic care between visits look like to your practice, and then how does CCIQ enable that?
So for me, it's keeping them healthy between visits. That's the main thing. That's the nurse in me. The other thing is building rapport. CCIQ has really allowed us to build better rapport with our patients than we had from years of them just coming into the clinic a couple times a year. They can message us, we message them. I do know all about their dogs and their grandchildren, even though we talk medical stuff. But when they build that trust and rapport, then they're more likely they want to stay with you. They want to come here. We're a specialty clinic, and we have patients that want us to be their primary care provider just because of the rapport we've built through CCIQ. So that's one of the main things. The other thing that, sometimes when you're only seeing a patient every 3 months or a year, when they come into the office, you find all these things wrong, and they may need carotids, and they may need a CT scan, and they may need to change meds. And then you're backtracking, trying to get all that done, all that scheduled, all that set up. We're able to identify that way before their visit, have all those things ready, those appointments lined up. And then when the doctor sees them, we have results. And so it's just easier for everybody, for the physician, for the nurse practitioner, for the patient. And that's the main way that I see CCIQ helping us between visits.
It's excellent. So stay with you, Lori, here for the next question, because you both brought up some examples, but I like to bring out these anecdotes just because, again, we're trying to get the rest of the 90+% of care providers dipping their toe in care management, and certainly chronic care management. So can you give us an example of when your team caught something early, or where you're able to act before something became a crisis, saving someone's life, essentially?
Yeah, I mean, so many times our patients say they come in, they have bypass surgery. Many of their medications are stopped for that surgery. And then when they're discharged, sometimes there's a lot of confusion between the hospital, the patient, the family, the staff there, the case managers, on what the patient is to restart when they go home. And oftentimes these patients will go home and they don't restart a med they're supposed to be on, say their beta blocker. And we can pick up on that and intervene. That's the main thing with me. And then just, so many times our elderly patients, if they run out of a medication, they think they have to wait until they see the physician again to get a refill. And we just make that smooth and easy.
Yeah, great point there. Fantastic. Jerri, so what are some examples? And you've been in the system for just a few months, but you have amazing findings already in using the platform. But what are some of the things where you mentioned an 8% reduction in hospitalizations? But what are some of your thoughts there?
Definitely, being able to communicate with the patients when they come right out of the hospital is so important, because, hospital systems, just like pretty much every business out there, is short-staffed. Or, you get where the patient, all of a sudden, they're going to discharge, and they're going to discharge them tomorrow or in a few hours. The patient doesn't want to sit and listen to a lot of education at that point. They're angry, they're wanting out the door. They might be upset because they feel they're not ready yet. Their family's waiting to drive them home. So they don't listen, and they get a piece of paper that they go home with. And, we've been able to capture things like they go home with an inhalation medication that needs a nebulizer, but they didn't give them a nebulizer. So,
Right.
There's a lot of things that, we'll get questions like, well, am I supposed to drink this? Or, no, it's an inhalation. So, being able to kind of be that fail-safe for the hospital systems to, get in there and, talk to these patients right from, hospital, then we're able to make sure they have the things they need. But, the fact that we can reach out in between and just ask, how are you doing? How are you feeling? And they're typing back lousy. How wonderful is that we're able to then have one of our team members quickly call them up and find out why they're lousy. Maybe they just need to talk. Maybe they just, they are having some decline right out of the hospitalization. So, that's going to help us keep them out of the hospital. And, CCIQ, like I said, I am so excited to see how far we can take this. My brain is just, since Matt and I've been talking, I have got so many different things I'm excited to kind of rope him into working with me on to change the senior healthcare. And I've assembled a team around actually the country that I think we can do it. I think we can make a difference. And CCIQ is going to be at the forefront of that, because it is so, it just runs. Like I said, my medical assistant, my top one, she's like, what do I do with this? I'm like, And then she had that aha moment. She's like, oh, I call a patient. Oh my gosh, how wonderful is this?
Right.
And that's, how we've changed since we've moved over to that platform. We're reaching out to these people that answer lousy, and we're making
Right.
sure that we're getting to them when they need us. So,
Well, and the
I'm
company was
excited.
founded on your exact example. I mean, Matt basically founded the company on, he had his personal episode and then realized got a paper script and a pep talk and went home and didn't remember a thing. And then, he didn't have that interaction with his doctor. So, but you want to say a couple words on that? 10 seconds or so, Matt, on that?
Well, I mean, when I left the hospital, I had to make myself bleed 10 times a day, right? I had to poke
Right.
6 holes in my fingers and give myself 4 shots a day. So that just as a 30-year-old at the time, um, I had to deal with something very serious and that wasn't going away, which kind of is a lot more in line with what seniors deal with after they're getting out of the hospital, et cetera. I was a caregiver to my senior parents also, so just trying to make things smoother and blend in there, right? So we can do our work better. I mean, like listen to these two. It's such a privilege to make something that makes what they do easier. This is why we're here.
That's right. So, and we're closing in the last 10 minutes of our expert panel here. So, I guess starting off with you, Jerri, how has the CCIQ platform created operational efficiency? And you've gone through some of these examples already and several, but anything else you want to highlight there and how it's made your day or your staff's day better or your patient's day better?
It's, it has made our staff life so much easier, because most of these platforms, they're not integrated. They claim they are, but they have to go in and document in a completely different system, and then they have to go back into the EMR and document. And the amount of extra work that they're doing just to accomplish their job is overwhelming. So I mean, already I'm seeing some of my staff members need more work because they don't have that extra documentation time. And we've done CCM for 10 years. So, we've, had every aspect of it. The thing with CCIQ is, though, it's seamless. It captures those phone calls. It captures the work. It definitely makes it just smooth and just flow perfectly. I like I said, some of these programs are just so difficult and they take so much time that your staff, they get worn out and they're
Mhm.
just ready to quit. So, and the patients, like I said, we deal with elderly patients, and they love the interaction. I thought at first it wasn't going to be something that was going to work with texting and seniors, because sometimes, when our generation gets up there to be seniors, which isn't too far off for me, we'll be tech savvy. But right now, we're still on that cusp. But I do have to say that most of our seniors, they've adapted and they're doing it. It's amazing. And the buildings are loving it. Our buildings that with our large assisted livings and memory care, they are getting the feedback and that, so they can properly align the patients with their caregivers.
Yep. Love that. Thank you. Lori, some of your thoughts there from you regarding
Yeah,
operational efficiency?
I agree with Jerri. It's capturing work we're doing anyway. It's work we're doing anyway. It's work we've been doing anyway. We haven't gotten credit for or reimbursement for. And so that just makes everybody's job a little easier and more efficient. Funny story, this morning I got a message from a patient and I went to check it thinking something was wrong medically, and she was lost trying to get to the MRI center. And instead of calling the MRI center or her PCP that ordered the MRI, she messaged me through CCIQ to help get her there. So I got her on the phone and got her to the MRI center. But again, that rapport we've built, they just think to call us for everything. And then we don't.
You've proven how seamless, obviously, that patient interaction is. They're messaging you like, you're right next door and right in the same room. Yeah.
And it's a patient I thought would never be able to text or do an app or anything like that. So they called on.
That's powerful. Wow. That's fantastic. Real quickly, so going to you, Lori, how has it shaped decisions around staffing or care delivery? And again, you've given some good examples, but anything you want to add on to how CCIQ has made a difference there?
Yeah, I mean, we take care of probably close to 400 patients on our CCIQ platform, CCM and RPM, And we've not had to hire any other staff to do this. We have about 10 case managers in the office. Some are kind of team leaders and trickle down, but it's all staff that's already here. It's mostly tasks they were already doing, patients they're already familiar with. And there's a lot of downtime in the office. We're a very busy cardiovascular practice, and we have plenty of time to take care of these patients without having to hire any other outside help.
That's powerful.
Yeah.
Yes, and same thing for us. We've had a reduction in, their daily tasks because they don't have to document in, 10 different spots. And it's allowed me to try to start to think of different staffing models that I could do. Because before I was a little bit of a snob, I have to admit, I thought only RNs should be doing chronic care management. But as this is kind of rolling out and I'm learning more about it, it's definitely something that, our medical assistants can maneuver and then escalate up to the RNs and the NPs in our system. So it, definitely it's going to affect our staffing ratios.
That's fantastic.
And two, at any given day of the week, all of your scheduled patients aren't going to show up. So if that's to see the physician, if that's for carotids, if that's for infusions, if that's for follow-up, some people, sometimes they're sick, they can't make it, they can't be here, but you still have all this staff here that you need to pay, and they need something to do. And we'll just say, it's a good time to do your CCIQ, and they'll log in and get that done. So it's worked well.
Yeah, and I think, Matt, not to put you on the spot here, but I believe the last stat that I saw was the average care provider that uses CCIQ with Athena is $103 an hour. We reimbursed. Is that how the numbers work? Because
well,
good
it's
ROI.
actually, so if you take yes, so the average the number of $103 is if you're an Athena practice and you take all of the patients enrolled versus all of the reimbursements generated, it's $103. If you just take the patients that qualified for the first reimbursement, and and about 75% of them are billable on any given month. But if you take out the ones that weren't billable, the ones that were billable generate over $153
Wow.
per patient per month.
Yep. It's significant.
And the productivity time, right? Because we get the offline time, the things that's already happening. And then we get the dashboard time looking for those patients that are trending in the wrong direction or exceeding clinical thresholds. And then if you have an MA reaching out to a patient that can't digitally engage, what time to call, what questions to ask, the hourly rate that staff can generate for the office exceeds $100 an hour. And it truly is putting all the pieces together, like Medicare's set up these reimbursements to financially protect the practice, protect the patients by protecting the patients. And but you can't do one of them, right? You got to do all of them. You got to engage the patients. You got to see how they're doing. You got to follow up with them. And I love what you said, Lori. Like I know their dogs and I know their grandkids, but it's communicating actually less, but communicating better and more productively. So
absolutely.
I love hearing.
Yeah.
We don't slow down often enough to get, we know what all the stats are, but you guys really bring it home. Thank you.
Yeah. So, I mean, even picking up on this, Matt, what role, go to you, Jerri, start off with here. What role does Athena integration play in making this work day to day? And again, you're newer to this process, bringing CCIQ in the last several months, but what are some of your thoughts there on the Athena integration?
And when I talk about the bidirectional, there are other companies on there and in Athena. And even though they claim to be bidirectional for the CCM, it is not. And so, I was a little hesitant at first, but boy, they definitely proved that it is. And it's really seamless into the Athena product. I cannot talk enough about Athena and CCIQ. I'm telling all of my friends in house call companies to make the switch, and most of them are. So, the combination, Matt and his team have they figured out to how to make it bidirectional and seamless. And, without that, you're dealing with a disjointed system that is never going to provide what CCIQ can, with capturing those phone calls, with, sending out the messages. Matt and I talked about it, and in 2 hours, I was like, oh my gosh, you get it. You know what it is that we need, and you're building it. So, definitely, the two systems work together. And I can't speak outside of that, any other system, but, with a health record, but definitely Athena and them they're a great match.
Yeah. Now, and this specific expert panel is focused on Athena and ChronicCareIQ. So you're in great shape, and great company. Lori, what are some of your thoughts there on how the integration has made a big difference in your work day to day?
Yeah, many different ways. I agree with everything Jerri said. Just the way it captures the work we're doing, that's huge. But just on a day to day, I remember when we first switched to Athena, and one of the reps came in, and Dr. Jones asked him, he said, "What can my staff do to better utilize Athena that you don't see them doing?" And he said, "Message each other and stop yelling." We would yell, "Hey, somebody's online," just all through the office. And now we're just messaging saying, "Hey, Mr. So-and-so's blood pressure's low. I just got an alert from CCIQ," and just office-wide, we're messaging each other. That's very smooth. Another thing is, any given day, Dr. Jones may walk in and say, "I need a list of all of my post-op CABG patients that also have PVD for this protocol that we're going to do." And we can pull that in Athena, by diagnosis. So those kind of things help. Or, give me a list of my veteran patients that have hypertension, because we're going to do a campaign for the VA. And normally we would just have to go through and hand count all that. And now we can just pull that through Athena. So it all works together well.
Oh, the reporting system is amazing, and I am a spreadsheet geek. And I tell you, there, like Lori said, there isn't anything you couldn't put together and run as a report in Athena. That definitely is a big help.
It's excellent. Thank you both for that. Yeah, these stories, this is why we do it. This is why I've been doing chronic care management personally for over 20 years now, and absolutely love it. And your stories is what kind of fuels us and fuels the entire industry. So thank you for all that you both have done and continue to do on a daily basis for healthcare, but also your communities. Matt, give you kind of a final word here. 90 seconds, 2 minutes or so. I think the number one question I want to pose out to you specifically is, how have you focused the product and also the company on helping providers scale? You're helping them scale their care delivery. You're helping them scale their chronic care management programs, and not burning out. I think that's one of the biggest things we hear about physician and clinician burnout in general, not just physician, but also clinician in general, burnout. And you guys did a phenomenal job architecting your product, integrating it with products like Athena. But talk a little bit about that in kind of a closing minute here to give, the importance of, hey, you can do this without extra resources. You can do this without burning out. It's actually going to stop you from burning out potentially. So go ahead.
Yeah. So first of all, the experience as a patient, which led me from IT career into health IT, and being inside of practices that were trying to adopt EHRs, and just seeing how compressed and pressurized everything is. So much work that has to get done. So then when we started this platform, we resisted the urge to do the quick check these boxes and be able to bill. We wanted to move the needle in patient care, and I always felt better after talking to my doctor. So if you want to know how chronic patients are doing, you have to communicate with them. And if you're not facilitating communication with patients, and if you're not engaging them, then it's not happening. So that was the first thing, was let's stay focused on patient engagement and moving the needle in care. And then, because my co-founder, and he never gets enough credit, he's an honor grad from Georgia Tech, is an engineer. And he is an incredible engineer, and he focused all the time on the back end. Why create extra work when you can take extra work away? So making sure that we were passively collecting the the information as much as we could, rather than, I think we're so used to in healthcare saying, okay, and then you have to go over here, and then you have to go over here, and then you have to go over here. Well, that's work where you're not connecting with patients or providing care for patients. So we've been really diligent about that, and and the two work together really well. And as far as the interface with Athena, I've always loved that platform.
Yeah.
I mean, it could you imagine having a smartphone without an app store? I mean, and they just do it so well. So I'm a little bit of an EHR snob since I know that industry so well, and they just do it really well. You know, there's a lot of good ones, but they do it really, really well.
Yeah.
I
They
hope that
enable.
was a answer you were looking for. I mean, look, the two women we're speaking with, you can hear patient care like just in dripping from their voices, and gosh, just just get them the tools so they can do that. That's uh, they need help, and
Yep.
God bless you all.
Yeah, no, this is great. Lori Francis, Clinical Director of Louisiana Cardiovascular and Thoracic Institute in Alexandria, Louisiana. Thank you so much, Lori. And Jerri Medved, co-owner of HomeMD Housecall Services out of Waterford, Michigan. Thank you both. You guys are both fantastic, true experts, not only on CCIQ and Athena, but also in care management in general. Your communities, as I mentioned before, are very fortunate and blessed to have you. And I have a couple questions here that came in. I know we're basically coming right up to time. I would love to, if you guys have a couple extra seconds here. Question that just came in: How did you first introduce the concept of chronic care management to your providers and staff, and what helped them get on board? So, Laura, you have a little bit more experience here, just from specifically on Chronic Care IQ. So start there, and then Jerri, I'll come over to you.
Yeah, I mean, it was really simple. I mean, staff was probably a little more reluctant than the patients because they thought they were going to have more work to do. But then when they saw it was going to make their job easier, they got on board quickly. Patients love it. You know,
Yep.
Patients, they love having, sometimes we're the only person that checks on the patient all day, all month. Sometimes we're the only time their phone rings. So they were very receptive. We just explained to them. I always say it's like you have a digital nurse in your pocket now, you know, with access to your physician, and they just love it. So it was an easy sell.
That's excellent. Jerri, what are your thoughts there?
You know, our office staff and medical assistants, they were a little easier to like convince to do this more because it wasn't question, it was a mandate, but they understand it, they get it. Now the providers have been a little harder to convince.
Sure.
And when I could promote the fact that financially I could help them on doing a lot of their work that they're not being paid for in their per visit rates, outside of a visit day, then all of a sudden it became a little bit more enticing. But since then, the majority of that are doing it effectively have noticed that they don't have to spend as much time when they're directly with the patient during their monthly visits. They can take care of a lot of those things in between visits because they're hearing about them. So it became more financially driven, but now I think it's patient care driven because they're seeing the benefit of it. And that's the biggest key is once healthcare providers as a whole, they want to do what's right. They want to do things to help,
Right.
The patients. And by being able to implement something like that, it's quickly evident that this makes a difference, a huge difference.
Fantastic. Great examples there. Last question here, because again, you both touched on this a little bit. What's the difference you've seen in patient satisfaction or patient engagement since implementing Chronic Care IQ? So Jerri, why don't you start off there?
With patient satisfaction and just with Chronic Care IQ, the texting where they can interact with us throughout the time, that is a huge game changer. But the chronic care management, especially with our population, it's needed because navigating the health system is just impossible for seniors and their caregivers and out-of-state family members that are trying to care for their parents or grandparents. So by us having systems where they can, you know, we can guide them. We can guide them to, you know, safe things for them and not anything that, you know, there's a lot of nefarious
Yes.
people out there trying to take advantage of our seniors. We're able to be there and help them, guide them through the whole system. And that's just a huge game changer for that population.
That's excellent, Jerri. Lori, your thoughts there on patient engagement, patient empowerment?
Yeah, I mean, we have a great retention rate for our patients, and I think I would be remiss if I just handed our patients a blood pressure cuff and said, take your blood pressure and we're going to be looking out for you. But we get a little innovative, and we always have. We use every Tuesday to send what we call Tuesday health tips, and we do that through CCIQ. We send that to our patients through that. They look forward to that. Some patients that hate to take their blood pressure and they really don't want to participate, they want to stay with us because they want the health tip. And then they want to send them to their friends, and they want to send them to their grandkids, and et cetera. So we have a really good retention rate, and I think they feel empowered. Just the education. I mean, I have some diabetics that don't know what a carbohydrate is, and we're able to help with those things through that.
Absolutely. Very, very important. Well, Lori, Jerri, thank you so much. Matt, this has been fantastic. You guys are terrific. Congratulations on what you've built and what you continue to serve and do for your communities. And thank you to everyone for joining us today. And stay tuned. We're going to continue these series probably on a monthly, every 6 weeks or so, these different series, and having different experts roll through. So again, thank you to everyone, and you guys have a great rest of your day. Thank you so much. Take care.